Good morning. Welcome, everyone. It is 8 o'clock on the dot, and we see got a lot of people still drifting into the virtual room. So we're going to give it just another minute. So grab your coffee, and we're about to start. All right, I'm seeing those participant numbers ticking up. For those who are just joining us, just know that we will start in about 30 seconds. All right, it is 8:01. Thank you, everybody, for joining us this morning. Welcome to the Colorado Health Institute's Hot Issues in Health webinar. Thank you so much for joining us. I'm Christy Ariano, Managing Director of Marketing and Communications at the Colorado Health Institute. We've turned on captioning for speaker remarks, which you can activate at the bottom of your screen. And we will save time for questions at the end of the presentation. That said, if you have questions that pop up early, please drop them in the chat. My colleagues, Deanna and Gerardo, are going to be monitoring the chat, and we'll try to address your questions as they can. If they can't, they will be sure to raise those questions when it's time for questions at the end of the presentation. I would love to know who is in the virtual room with us this morning. If folks could just drop your name and organization in the chat and drop it so that everybody we can see. This way we can get a sense of who's in the room with us. All right. I see Lisa from Longmont, Lucia from Civic. Thank you so much. It's great to see so many familiar faces and organizations. Colorado Access is with us this morning, Colorado Nurses Association, and Elbert County Public Health. Thank you, everybody. Keep letting us know you're here and who you are. Welcome to the folks from the Farley Center. All right. I suspect that most of you are familiar with the Colorado Health Institute, but for those of you who aren't, let me just share briefly. CHI is a nonprofit, mission-driven public health institute. We advance equity and well-being in our communities through deep expertise and implementational know-how. We've been working with community groups, providers, state and local governments, and foundations for more than 20 years. We provide trusted analysis and data, strategic planning, facilitation, complex modeling, evaluation, and strategic communication. In addition to our work with clients, we have a philanthropically funded portfolio of work, and that includes our legislative efforts. We're grateful to the funders who make this work possible. Our legislative work is strictly nonpartisan, and CHI does not lobby. And with that, I'll turn it over to Joe Hannell, who co-leads our legislative team.
All right, thank you so much, Christy. Well, our lineup for today is first me. I've been at CHI for 10 years this month. Before that, I was a reporter at the Colorado State Capitol with both of our panelists today. So they're my former colleagues, current friends, Marianne Goodland and Benta Birkeland. I've got about 20 minutes or so of a preview, and then we'll turn it over to probably the two most experienced Capitol reporters in the state here. But first, let's get to it with our takeaways. Our recap today is going to be far from comprehensive. A lot happened in the 2024 session. We're not going to try to cover nearly all of it. We'll have a legislation and review report coming up next month that will go into a much wider scope. But for today, we picked out three themes that we think are interesting for public health and social policy. And we'll lean heavily into health and social policy today because we know that housing is tied so closely to health. We know that poverty is tied so closely to health. If you're worried you're missing out on some big healthcare legislation, Don't worry, you're not. 2024 was not a year for making wide-ranging new laws about healthcare. So our first theme is legislators came into 2024 with some big hopes and dreams. These were often scaled back when they ran into trouble with either a lack of money or a lack of political support. But we think there were a few bona fide legacies of the 2024 session that are going to have a lasting influence on people in Colorado. We're thinking here about a first of its kind bill on neural privacy, and then some really high dollar efforts toward reducing poverty, especially for young children. And finally, the state budget and the taxpayers' bill of rights loomed large this session, and they're going to continue to be major forces in the next few years. So let's start with this first theme, ambition meeting reality. We're going to spotlight three topics: affordable housing, gun control, and behavioral health. The affordable housing story really starts last year when Governor Jared Polis wanted to do something big to address the state's major housing affordability problems. Trouble is, the state doesn't have much power over housing issues. That's traditionally up to cities. So Polis backed this major bill, Senate Bill 213 in 2023, that would have overridden city authority on zoning matters and required higher density. He lost that fight. So this year, Polis and his allies decided that to break the bill, or start with that bill, but break it into smaller pieces. And they succeeded to a point. They passed four bills that all tread somewhat on local government turf. They ban occupancy limits, or they raise occupancy limits in some cities for houses. They make it easier to build an accessory dwelling unit, aka mother-in-law apartment or a granny flat. They roll back parking requirements for multifamily complexes, and they push for higher density housing around transit stations. But most of these bills were scaled back from their original versions, and they tend to rely now more on carrots than sticks in trying to get local governments to accept more housing density. Unrelated to that package of bills, legislators also passed new laws on tenants' rights, some pretty substantial ones too. They made it harder to evict tenants without a good reason. They eliminated court fees for tenants being evicted, and they gave landlords tighter deadlines to repair problems at their properties. And finally, the legislature passed a bill backed by local governments on doing a statewide housing needs assessment so we could all get our arms around the scope of the problem. The legislature's done a lot around firearms control in the past few years, and many Democrats especially wanted to do more this year, but it was a bit of a tug of war. First, there was a bill that set out to ban carrying guns in most public places. That would be a big stretch from where we are right now. Colorado allows open carry, and a lot of people here have concealed weapons permits. But that bill got scaled back quite a bit. It still, though, bans carrying guns at the state capitol complex, city halls, courthouses around the state, as well as childcares, schools, and colleges. Next, there was an attempt to ban assault weapons, things like the AR-15, one of the most popular guns in America. That actually passed the House, but it was voted down in its first Senate committee. And finally, here's one to watch for the rest of the year. It's an excise tax on guns and ammunition. And this one goes to voters, and it will really be, I think, one of the first times that Colorado voters have weighed in on guns in quite a long time. So look for that on the November ballot. Next, on behavioral health. And we'll wrap up with the reality section with this. Big thing that happened this year was the legislature funded the I Matter program, gives 6 free mental health appointments to any child in Colorado who wants one or whose parents want one for them. And that's mostly through telehealth. But some bigger ideas didn't pass. Colorado has, at best, a very disjointed system for youth mental health care. And legislators had introduced a really ambitious, wide-ranging bill to remake that system. It didn't pass, though, in part because the state had just settled a lawsuit, actually during the legislative session, on this matter of not providing a decent mental health system for youth. And over the next 5 years, the state's going to be remaking that system as part of the lawsuit settlement. There was a smaller bill in this area that passed that aims to repair the system for crisis care, for once things get, so bad that somebody needs to be hospitalized or in in-person care. Second, a bill failed that would have allowed overdose prevention centers. This has come up several times over the past few years. These are also known as supervised use sites where people can take drugs without fear of being arrested, and where staff are there with overdose reversal medications. And third, there was an attempt to do something about the most abused substance in the state, alcohol. It would have put a new fee on alcohol sales to pay for treatment and prevention, but it just simply didn't have the votes. So those were some partial victories and losses for public health and social bills, but there were a few landmark bills that did pass. First, kind of flew under the radar, except for this front page story in the New York Times. It makes what advocates say it makes Colorado the first jurisdiction in the world to protect the privacy of people's neural data. So the issue is there are now wearable devices available that can, in a way, read your mind. These are still kind of niche devices. But they show a lot of promise for treating neural diseases like epilepsy, or there's even just kind of consumer applications like guided meditation. There's talk of putting this technology into earbuds or on your smartwatches. If you attended our Hot Issues of Health conference last December, you saw the keynote speech from Nita Farahani, who's been out spreading the word about the great promise and great risk of this technology. She argues that now's the time for regulators to catch up and start passing laws and norms for this technology before it gets away from us. And that appears to be what Colorado legislators have done here. Next, the next real legacy of this session, I think, is anti-poverty policy. During the pandemic, the US Congress expanded the National Child Tax Credit. And overnight, that cut child poverty nearly in half. And then they let it lapse. And overnight, that progress was undone. Well, Colorado legislators took a big step toward restoring that credit with the Family Affordability Tax Credit. It provides a refundable tax credit of up to $3,200 per child under age 5. The credit gets smaller as a family's income increases, and it's smaller for kids between 6 and 16. They didn't stop there, though. They also expanded the earned income tax credit. It was a policy with bipartisan roots. It's been hailed as probably the most or one of the most effective poverty fighting policies around. And then they passed a tax credit for direct care workers who are in these notoriously underpaid jobs in nursing homes, childcare, and other high-touch, human-centered occupations. How could they possibly pull this off? Well, it has to do with the state budget, the famous Colorado court called the Taxpayers' Bill of Rights. Let's go to the state budget first. First of all, the whole state budget is $42.9 billion. But the legislature doesn't have much say over most of that money. They do control the general fund, however, which is just over $16 billion this year. I'm going to show you a graphic that we've broken out by education agencies on the right and human services on the left. So K-12 is a huge part of that. Colleges, somewhat smaller, and we have um, the new preschool, universal preschool there in Department of Early Childhood. Then healthcare policy and financing, that is our Medicaid program. It's now by dollar the largest department. Human services, a big chunk, but quite a bit less than that. And public health and environment, not much general funding at all. Most of its funding comes from elsewhere. And then this is everything else that the state government does. So a few notable highlights here. In K-12 education, for the first time since the Great Recession, since I had early in my days as a reporter, K-12 schools are fully funded under the funding formula that they should be in state law. Also, the legislature had to find $56 million to pay for the new healthy school meals for all that voters adopted a few years ago. There was just less revenue and more demand for the program than they had thought. So that's going to be an ongoing issue. Over on the health side, in CDPHE, they added $16.5 million for public health. Now, this continues a major change they made with sending general fund dollars for public health functions, both to the state and in this case, $11 million to local public health agencies. That started in the pandemic when people suddenly remembered that, oh yeah, public health is valuable. There is trouble ahead for the budget, though. Legislators have actually overspent. It was out of balance basically the week after the budget passed. First of all, the director of the legislature's nonpartisan budget staff warned that they have balanced this budget by using about $450 million in one-time accounting moves that aren't going to be available next year, but that are paying for ongoing problems. So right out of the gate for 2025-26, they start out about $500 million behind. And then there are troubles with a funding source for an insurance fee that funds the reinsurance program and Omni Salud, which is subsidized insurance for immigrants. And these are two of the really kind of marquee accomplishments in health coverage for the Polis administration and the legislature the last 5 or 6 years. So they have money to get through this year, but now they're casting around for a new funding source. Overall, that means next year's budget, in small ways and big ways, is going to be just a lot tighter. That brings up what to me is a fascinating topic, what legislators are calling, or Democrats are calling, Tabor gymnastics. So if you're new to Colorado, no other state has a taxpayer's bill of rights quite like ours. There are two big things to understand about Tabor. One, voters have to approve tax increases. And two, any revenue that the state collects over that exceeds population growth plus inflation has to be refunded to voters. That's been the law since 1992, and Democrats in particular have hated it because all that money is given out in often small tax refund checks, when they think it could be used for schools or social services or other places. But Democrats are figuring out that if they're stuck with Tabor, they could at least seize it as an opportunity. Colorado's entered this time of large Tabor refunds. You see that in the green bars here in this graphic. We're talking about a couple $1 billion a year that need to be refunded to voters. Now, here's where the gymnastics come in. What if the state did have to refund all that money, or some of that money, because it didn't collect it in the first place? Well, Governor Polis has had that thought. He thought the simplest thing to do would be to cut the income tax rate. But legislative Democrats had different ideas. They thought, what if we offer tax credits targeted to the people we want to help the most, which are, the neediest people in the state? This is where they got the money to pay for the child tax credit, earned income tax credit, direct care worker credit. In the last few days of the session, they worked out a deal with the governor that he would okay this, and he would also get at least a temporary income tax credit. The trouble is that these anti-poverty policies are now tied to Tabor, and if the economy slows down and the Tabor surpluses go away, these tax credits probably are in a lot of danger as well. But that did not stop. A bit of a tax credit enhancement. Our legislative monitors at Frontline Public Affairs, shout out to them and thank you. They found bills that would have given out about $1.5 billion in tax credits this year, and about a third of them failed. The biggest ones that passed were the ones we've discussed for child tax credit and earned income tax credit. It's starting next budget year. That's almost $700 million for the child tax credit and a couple $100 million. Some legislators had wanted to address affordable housing through tax credits, but those bills were mostly voted down. And then there were several often Republican-sponsored credits on education, including taking away sales tax from school supplies, giving teachers credits. In most cases, the education-related bills failed. However, there's one that we found real interesting. College students, income qualified college students, are going to be able to get a tax refund for their tuition, up to 65 credit hours of tuition. And then finally, there's this direct care worker tax credit that we talked about. So that was a lot of information, but it's just a taste of what happened at the Capitol over the past 4 months. Before we bring up our panel, I'll share our takeaways again. There were big ideas on affordable housing, firearms control, and mental health that sometimes got reeled back in. The legislature did pass some, what we think are going to be landmark bills on neural privacy and poverty. And the budget's tight and getting tighter. We have this new dynamic with tax credits and the taxpayers' Bill of Rights. With that, I'm about to bring up our panel. If you have questions, you can share them in the Q&A. You can also use the raise hand function, and we'll take you off mute so you could talk directly to the panelists. It's often a lot more engaging if you do it that way. All right, I want to introduce our panel quickly. First of all, Marian Goodland is Chief Legislative Reporter for Colorado Politics and the Group. She is the longest serving reporter at the state capitol. She's been writing from there since 1998. Also president of the Denver Press Club, if I'm not mistaken.
That's correct.
All right. And then Bente Birkeland has been covering the Capitol since 2006. In 2017, she was named Colorado Journalist of the Year by the Society of Professional Journalists. and she's been working for Colorado Public Radio since 2018. Before being a journalist, she was a research analyst at the U.S. Department of Justice. So with that, I'm going to stop my screen share and bring up our panel here. Pardon me a moment while I spotlight our, oh, okay. Looks like we've done that already. Thank you. All right. Well, Benta, Marianne, thanks so much for being here. And it's just it's great to be in the same virtual room as you again. We've shared cramped quarters at the Capitol and committee or tables on the floor of the House long into the night. I think it's only gotten a lot worse for that since I left.
We miss having you as our desk mate, Joe. Joe sat next to me for quite a few years, so.
Yeah, it was it's a whole different lifestyle there, and I kind of hope we can get into some of that with our questions here. I know we've got some coming in the Q&A, but I wanna start out with a few questions. First of all, I'm really interested in affordable housing and your verdict on what happened and how substantial the bills that passed really will end up being.
The latter question is going to be a little tough to answer because we don't know whether any of these things that are being proposed are going to work. As far as successful, very much so. The governor got pretty much everything he wanted on the issue of affordable housing, whether it was breaking up 213, as you had mentioned. All those little pieces of 213 are now in law, although, as you mentioned, not as vigorous, perhaps, or robust as I think the governor would have wanted. The transit-oriented communities one is sort of the highlight bill of the session, I think, and it requires a higher density, 40 units per acre, near transit routes. It's not just RTD or light rail stations. It's also bus stops and bus stations throughout a group of 5 what are known as metropolitan planning organizations. There are four of those are on the Front Range. The 5th one is out on the Western Slope in the Grand Junction area. The big thing with the transit-oriented communities bill was what happened to it when it went from the House to the Senate. House Democrats, and this was what was kind of interesting. House Democrats vowed that certain House Democrats vowed that if the bill came back to the House as it left the House, they would do everything they could to kill it. And that had to do with 2 things that were in the bill. One was that the state could seek a court injunction against local governments that refused to play along with this. The other, and the one that really had local governments very upset, was that they would be deprived of their state transportation funding. And for some communities, Arapahoe County, for example, that's almost half of the money that they have for roads and bridges. And that was a huge fight. And the first thing that happened when the bill went over to the Senate is they stripped all those things out. And that cost the bill the vote of a leading progressive senator who wouldn't vote for it without it. And that was Julie Gonzalez from Denver. She was one of the few progressives to actually vote against this bill, but that's why. So the governor got his transit-oriented communities bill, albeit not as robust as he would have liked. The ADU bill, which is, as you mentioned, Granny Flats Casitas is another one. That one, and Benta, you might be better on this one than I am, but I don't remember any really huge changes. It affects those same 5 metropolitan planning organizations. The difference in those bills is when you look at what we had last year in the housing bill, it was going to be a much more statewide bill. This is very limited to 31 municipalities.
And I think just following up with what Marianne said, a lot of the more, some of the more progressive Democrats who were very upset at the end of last session with what didn't happen on housing and affordability, they were pleased with what was accomplished. I just think it's going to take quite a few years out to see what the actual implications are. How many ADUs are built? One of my colleagues interviewed someone about what's happened in other states like California. How much does that increase the volume of housing supply? Same thing with the parking minimum, doing away with that. So I think all of this, I hate to say to be determined, but we don't quite know yet what the impact is going to be. One thing I looked at was the warrant of habitability. There was a lot of things to help renters, and that's one that tries to make it more clear, like what landlords need to do to make something habitable. And so there were some changes there. For instance, if you have a disability and there's not an elevator that's working and that breaks, you can break your lease. So I think people were happy with some of the changes, but a lot of it's going to be quite a few years out
All
to
right.
see how effective it is and what difference it may make.
Okay, we've got some questions from the audience, but I want to use my prerogative and ask one more here about firearms. It's just it can be a very emotional topic when you're making public policy about gun control. Give us a sense of what it was like in the Capitol this year. I hear that it just wasn't quite the bills that came up this year just didn't quite attract the same level of public opposition from gun rights advocates, and then especially this assault weapons ban. What happened there that it would pass the House but not the Senate?
The governor has been pretty clear that he is not a fan of this. So the bill died in its first chamber last year in the House, and then never made it out of a Senate committee this year. And the governor, I think, is still pretty skeptical about this. The one person in the Senate, this may be a surprise, who is also kind of on the governor's same page is Tom Sullivan, who has been far and away the leading advocate for gun violence prevention, has sponsored the red flag bills and a lot of the gun bills. He wasn't crazy about this one either. And the premise that both Senator Sullivan and the governor have on this is that this really should be dealt with at the federal level. Not that anybody has any expectation that it will be dealt with at the federal level, but the comments by the governor and by Senator Sullivan have been pretty much the same. If a person wants an assault weapon, drive up to Wyoming and get one. It just the assault weapons bill only prohibited the purchase in Colorado. You go up to Wyoming and buy an assault weapons, you pass your whatever rules and regulations they have up there, you can bring it right back down in Colorado and it's perfectly legal. What good did that do? The bill really doesn't have the kind of teeth in it that I think would satisfy a lot of the folks who are seeking assault weapons bans, not to mention Wyoming's only an hour and a half away.
All
I mean,
right.
I think one thing I would say is just the whole tenor. I mean, things change in politics fairly quickly, and it seems like something's always going to be one way and then it isn't. But as you remember, Joe, a decade ago at the Capitol with the high capacity magazine ban in Marianne, I mean, it almost would like stop the Capitol from, it was like everything halted when those bills were happening with helicopters or not, the plane over the Capitol and cars circling all day. It hasn't been like that for a few years. And Senator Sullivan has said he wanted it to be a routine policy, just like any other public policy that comes up each year. And I think this year we really did see that. I mean, they passed a lot of bills, like banning guns at the state capitol and polling places, and then requiring firearm dealers to have a state permit, getting the CBI involved with more investigations on the unlawful purchases. The merchant code to better track things. So a lot passed, but it was a little bit more technical. And even though there was opposition, it's not like people flooded to the Capitol for it. And then I think with the assault weapons ban, that has been a kind of a no-go for Democrats. I mean, last year was the first time they ever even introduced a bill. The fact that it got out of the House, I think is a pretty huge thing. And then when you have the one member in the state house whose child was killed in a mass shooting saying he doesn't know if this is going to be the most effective policy, I think it's very hard for Democrats to get that through. And the two committees that bill was going to go to, Democrats have it's a one vote majority on those committees. And the other committee, one of the swing votes there, I think, was going to be a no vote. So I think there was a lot more concern about that bill in the Senate. And I think sponsors knew even if it got out of the House, it was going to be pretty challenging. But I think the whole dynamic with Senator Sullivan makes it especially tricky and sensitive because he's made that issue his priority. That's the reason he ran for office, and he has passed a lot of bills to try to strengthen the state's gun laws.
All right.
There's another aspect to all of this. The folks who oppose these gun bills are now finding out that opposing them at the Capitol isn't going to work. They don't have the votes. Where they're hoping to be successful is in the courts. And a lot of these bills are being challenged in the courts. We had, I think, 3 of them from last session. Ghost guns, which the courts have now affirmed was okay. They're banking on the courts siding with them. And it's not a bad strategy given the Supreme Court's ruling on a couple of gun issues. This is the strategy they're pursuing now. They can't fight it at the Capitol, fight it in the courts.
All right. Very, very important point there. Yeah. I want to go to a few audience questions. We've got one from Phyllis, who's asking about health insurance. Basically, the uninsured rate is ticking up because of Medicaid is the pandemic-related eligibility extension is over, so they have to disenroll people. We also have a bunch of new people in the state coming in, often from Venezuela and other countries, and then healthcare is just unaffordable. So Phyllis is seeing this in the safety net clinics that she says if our experience indicates the trend, our uninsured rate may be as high as pre-Affordable Care Act rates, which was, above 15% or so. Are you hearing anything at the legislature about lawmakers being concerned about this, and what's being done about this?
I haven't heard a lot of concern about this. However, I think it's coming. And the reason for that are the ballot measures that are on the November ballot around property taxes. Funny enough, this could have that kind of impact. There is a tie-in to this. If initiatives 50 and 108, 50 is already on the ballot, 108 is pretty likely to show up on the ballot. They're both sponsored by the Advanced Colorado Institute, a right-leaning organization that just wants to cut property taxes. But those measures don't have any backfill to cover the impact to local governments. And the largest one is to school districts. There's a fear that those ballot measures will be about a $3 billion hit to the state budget. Well, state law requires the General Assembly to fund education. And if there are big cuts in property taxes, the state's got to backfill that. That's the law. So the question becomes and especially with a very tight budget year coming up, where do you go for that? Republicans have had Medicaid as a target for decades. They want to see Medicaid spending cut. And unfortunately, Medicaid spending is not required by law. So you could see this issue of the uninsured. This could get to, if that measure passes, this could be a really major hit. I agree with Phyllis here. This is something to really worry about.
Benta, I'd mentioned early on, there just was not a lot of healthcare legislation this year. Is this something that's still on people's minds?
I think so. I mean, certainly we hear a lot of lawmakers talk about mental health and the safety net, and how concerns about behavioral and mental health impact so many other facets of society, from the criminal justice system to outcomes in schools. And like you mentioned, everything's interconnected. So I think some of the measures they passed this session on trying to reduce poverty for lower income Coloradans, they see that as, increasing that safety net, but it kind of ebbs and flows a little bit in terms of what gets, what kind of gets focused on for that session. And I think for the last couple sessions, we've at least seen from the governor this housing affordability issue being his top priority. Not that we don't have bills on every other topic, but I still think that was kind of the overarching focus of the session.
Okay. How about education tax credits? Somebody, anonymous attendee, wants to ask what happened to the education tax credits? Why were they so unsuccessful?
I don't think that, I don't think people are opposed to that in concept. I think there's just a lot of things, there's not enough money for everything. So there were so many tax credits proposed, and Democrats really wanted to go with the ones they went, with the deal with the income tax reduction, and the child tax credit is where they wanted to put their focus. But I mean, so many of the tax credits, I think people could get behind for sure if there was the money there. I know there's a philosophical opposition to using tax credits, but if you're going to use tax credits, at least maybe you heard differently, Miriam, but I didn't hear opposition to like the school supply tax credit.
Yeah. But I think you're right. There was just a limit to just how much they could afford to tap the Tabor surplus for. And that's where a lot of these tax credits are being paid for.
Right. Got to take a question from Allie Morgan, who used to do this presentation with me. She was our legislative director for many years here at CHI. Who's now with Association of Local Public Health Officials, and she wants to know what happened with a failed bill to expand county authority to regulate vaping. And I'm going to see anything more on, especially on flavored vape products this year, and also the alcohol bill, addressing alcohol as a substance use issue after the fee tax bill failed. What's next for that?
I honestly, I didn't cover either one of those bills, so I'm afraid I wouldn't be the best one on that.
Yeah, I mean, one of our health reporter who's been out for part of basically the session, he's covered a lot of the vaping stuff. I think that, I don't, what the county authority, I don't know, because we'd heard from Polis, it should be left to local communities. When he opposed the statewide ban, that's why he said it should be local control. And that expands county authority. So, and I'm not saying it's all Polis. I mean, at least with some of these issues, a lot of lawmakers that I've talked to have said like, oh, it's just a personal decision. We shouldn't be micromanaging things like that. I hear that from members in both parties. Could that shift? I think so, but also we don't have the governor who's strongly in favor of this kind of thing. So his office isn't putting his weight behind this. And I think, I'm not saying that would be the whole reason, but I think that's part of it. If this were one of his top priorities, it might be different. I know a lot of lawmakers feel strongly that the state needs to do more on both of these issues. So, it's kind of going to depend where Democrats land with their huge majorities, unless in November that gets narrowed down a little bit. We'll have to see.
Well, this kind of gets into something that I've been just noodling for a little while, that Democrats are funding a lot of things they like by putting taxes and fees on things they don't like. So universal preschool is funded by tobacco and vaping. There was an oil and gas bill this year. The big compromise is fee on oil drilling to pay for transit. You could maybe even stretch that to Tabor. It's like, well, let's take Tabor, this thing we fought against, and take the revenues from it to do our anti-poverty work. Is there talk at all in the Capitol about ultimately setting up some like a dilemma that they don't want to have to deal with, that if they want to fund preschool, it depends on a certain amount of people smoking and vaping.
Syntaxes. That's what they used to call it. It's fascinating to me, the desire by lawmakers, and it's not just Democrats. Republicans had as many bills on tapping Tabor surplus for tax credits. It was kind of surprising everybody. But frankly, that was the only source of money that was out there. So the only, you can tap the Tabor surplus, you can impose more fees on oil and gas. One person that I spoke to about that oil and gas additional fee just thought it was just ludicrous that something that they have hated, that the Democrats have hated for years, which is oil and gas, they're now saying, well, it's okay. Oil and gas is fine if we can make you pay for the other things that we like transit. And they kind of one senator referred to it as extortion. There was a Republican senator whose district includes Weld County. So it has been really interesting to watch how people's views about what to do with tax credits and imposing fees and stuff, how they've managed to do that this year in a year when there was no money for anything else.
I think the counter to that is, oil and gas drilling exists. Why not increase this fee and use it for something we want to use it for? You could say that with vaping, alcohol, even the excise tax on gun and ammunition purchases. Some Democrats clearly don't want there to be more gun and ammunition purchases, but they're the ones who supported sending that to the ballot to pay for domestic violence services and services for other, crime victims. And some of it would go towards behavioral health for youth and veterans, I think. So it is tricky. I think it would just depend on how morally opposed you are to that underlying funding source.
All right. Well, Benta, I know we're going to lose you in a couple of minutes. I want to get to a question from Kyle that I know is probably near and dear to the hearts of reporters and just everybody around the Capitol. Is there any discussion in the General Assembly for figuring out a way not to have hundreds of bills on the calendar in the last 2 weeks? With the timing of the state budget, it stacks all these bills up in appropriations, and Kyle says it's hard to see bills with support die because they've just run out of time.
Well, I wrote a lot about this, about bills that, how many bills we had left. As of Monday morning, with 3 days left to go, 1/3 of all the bills introduced in the 24 session were still waiting for final resolution, 1/3, which to me was just mind-boggling. And that was far more than we've seen in a lot of years. But what happened on Monday, which I referred to as the Monday Massacre and the Red Wedding Monday, was that we had about 50 bills that died in the appropriations committees. And that lessened the backlog quite a bit, but a lot of that had to do with the lack of money. I mean, these were bills, some of these bills had really pretty major price tags. That overhaul of the behavioral health system for kids, that was one of them. And at one point, that bill had a $2 billion price tag, and it's like, where are you going to find $2 billion? It just, and most of those bills died because of lack of money, lack of strong support, and 3 days left to go. Do we really have time to get into fights about this stuff? So I'm not sure the calendar management was that good this year. They didn't wind up introducing a lot of bills in the last 10 days, which has been a kind of an issue in the past. They just had a lot of work that just didn't get done.
I mean, I think to Kyle's question, we all think about that. I mean, towards the end of the session, lobbyists and journalists and everyone who's following it. I think that with the timeline of the state budget, it would be hard. Even people introduce bills that have support and maybe could pass, but have an appropriation, and then they're just sitting there for weeks and weeks and weeks. I don't know if that could be shifted. I haven't really heard the budget timeline shifting. I have heard lawmakers talk about reducing how many late bills are introduced and limiting the number of bills. When you look at how many bills some people could be a prime sponsor on, it could be 20 bills or however many. They just want to make sure it's manageable and things are getting considered. There comes to a point where it's just the volume is so high in terms of reading all the policies, understanding them. It's just, there's kind of just, we didn't even have Republicans reading bills at length and doing tactics that the minority party does have authority and leverage to do to slow things down. We didn't see much of that at the end of the session.
Yeah.
But just the
But the
volume of,
majority did this to themselves.
yeah, yes, Democrats did this to themselves. And we always see that on a lot of big things like the oil and gas compromise that dropped basically almost the final week of session. It was a few days, it was in the final 2 weeks. So that's always happened. But, other than maybe limiting bills, I don't know that we won't see this type of thing next year. And part of it's human nature too, when you have that deadline. It forces people to come together. And then we have the outside ballot initiatives and those things were exerting pressure. So, but I haven't heard, unless Mary Ann has, I haven't heard much about, the timing of the budget. But I do think that appropriations committee is another big sticking point. And I do have to sign off early. So
Right. Well, thank you so much.
thanks, everyone. Feel free to,
yeah.
Joe could put my contact information, but feel free to
All right.
reach out to me with anything or anything you think we should cover. So
CPR.org and 90.1 on your FM dial. We'll listen for you. Thank you.
thanks everyone. Bye.
Bye-bye. Mary Ann, if you could hang out for a bit, there's a attendee question that is asking the same thing I'd like to know about. You'd mentioned a couple of ballot initiatives that are already on the ballot. What else of interest for healthcare is likely to end up on the November ballot?
There are efforts to overturn a lot of efforts actually to overturn a lot of things that happened in this legislative session. There's one to overturn the bill on how you obtain a concealed handgun permit, concealed carry permit. That was a very controversial bill that was carried by the majority leader of the House. There's a ballot measure to overturn that. There are several bills dealing with gender congruence, I think is maybe the word that's being used here. There's a bill to ensure that boys play on boys sports and girls play on girls sports, and that those who identify as transgender are not allowed to participate in sports. You have another one to attempt to overturn a bill that requires schools to identify a child by the pronoun and name of their choice. This was another bill that went through the legislature. This one is also, there's an attempt to overturn that one as well. One of the big ones that actually didn't wind up happening that I thought was really kind of interesting had to do with medical liability. And that was toward the end of the session. There were the trial lawyers and the hospitals both filed ballot measures to deal with the medical liability issue. The trial lawyers wanted to remove all limits on how much you could sue for, and the hospitals wanted to impose greater limits. And those ballot measures have now are going to be pulled now, despite the fact that there was almost $5 million in campaign finance donations put toward those three ballot measures. But there was an agreement made at the very tail end of the session, and there was a bill passed to kind of address a lot of those concerns, and so those ballot measures are all going to go away. Those are kind of the biggest ones on the issue of the things that were related to sort of the healthcare issue.
All right. One last question here before we wrap up and let everybody refill their coffees before, I'm sure, all their 9 o'clock meetings. There was again this year a bill for a study on universal health coverage. House Bill 1075, and that just
Correct.
that didn't pass. What's the blockage there?
One of them is the fact that voters have already said no to this. And that was a fairly persuadable argument for some lawmakers. There's been this effort to go with a universal healthcare, single payer system, and that's what it is, it's single payer. And I'm not sure how much support that has from the first floor, the governor's office, and certainly voters have already said no. So that had some sway at the state capitol, even though it was just a study. I mean, those things are pretty innocuous. It's one of these things where if you want to set something up and you're not getting your way, you do it as a study in hopes of keeping it moving forward. That didn't work either.
All right. Well, Marianne, thank you, and to Benta for being just fantastic panelists. It's brought back memories for me, so thanks a lot for that. And thanks to everyone in our audience too for hanging in with us. I want to invite everybody to our next webinar in just about a month. It's about the Colorado Belonging Barometer. It's an exciting new project that CHI is helping out with to measure how well people think they belong here in Colorado. You can sign up at colorado.health/belong, or this QR code here works as well. And with that, I'd like to wish everybody a happy Thursday, and thanks a lot for joining us. Bye-bye.